Why is my baby blue? What is an APGAR score? And why in the heck are you pushing down on my stomach so hard right after I just had a baby? These are 3 things that I wish I knew before I gave birth from a birthing and postpartum doula. Hey mommies and daddies, Nellie here, and I offer tips and tools to help new parents figure out their kids. If you're into that, follow me and click the link in my bio. Let's talk blue babies first. You did not eat too many blue things while you were pregnant. Most babies come out looking blue or purple in color, and this freaked both me and my husband out like crazy. It's also the question that my birthing clients just asked me as their baby was born. So why does this happen? The baby has been getting its oxygen from the mother's blood. So this is the reason why it can stay alive without having to breathe. But the mother's blood is lower in oxygen level than the air. So coming out bluish is totally normal. Babies' oxygen levels will continue to climb as soon as they start taking breaths on their own. That's when they start pinking up. And it usually will normalize in about 5 to 10 minutes after being earthside. Their hands and their feet can stay a little blue for up to 48 hours, and that's completely normal. It's actually called acrocyanosis, and it's your baby's way of keeping all their oxygenated blood for their brain and their internal organs at first, and then eventually moving it out to their hands and their feet. Now this brings me to the APGAR score because it is one of the 5 things your baby will be scored on their very first test. An APGAR score is the total number of points that your baby will score in 5 categories. The 5 categories are activity or muscle tone, pulse, grimace, whether or not they like to get their reflexes checked, appearance, skin color, and respiration. APGAR. This test is given at 1 minute and again at 5 minutes after birth. These 5 categories are scored from 0 to 2. The total is added up, and that is what your baby's APGAR score is. Most babies won't get a 10 out of 10 because they still may be a little bit blue. This observation test can usually be done on mama while doing skin to skin while your doctor is waiting for your placenta to be birthed. The birthing of the placenta brings me to the 3rd thing that I wish I knew before giving birth. After you birth your placenta, and I do mean birth because sometimes it does take a little push to get that thing out, your nurse or your doctor will give you what's called a fundal massage. Now, this is not a pleasant massage. This is actually a very uncomfortable massage. It's not good at all, but it's very much needed. A fundal massage is a hands-on technique that applies firm and rhythmic pressure to the fundus, which is that muscle at the top of the uterus that helped you push your baby out. This is important because it starts to wake up your uterus to get it to contract again, which will reduce bleeding and help it get back down to its pre-pregnancy size. It also helps to expel any remaining blood clots or tissues from the uterus, reduce the risk of infection, and to promote faster healing. The biggest reason, though, is to prevent postpartum hemorrhage, which is one of the leading complications after delivery. This massage is going to be done every 15 minutes for the first couple hours after delivery, both vaginal and C-section, and then periodically through the next 24 hours, and then less often in the following days, depending on your recovery. Here's a tip. Understand that this is going to be pretty uncomfortable, but the pain should not be unbearable. So if it is, make sure you let your nurse or your doctor know. For more tips and tools for your parenting adventure, like this video and check out my YouTube channel.